and today I'm going to explain the difference between cardiac arrest and a heart attack. And I'm going to give you 5 reasons why cardiac arrest is deadlier than a heart attack. Now, I'm sure you've heard of a cardiac arrest or sudden cardiac death. When someone is moving around, they may seem perfectly normal, and then boom, they drop lifeless. And you've probably also heard of the fact that heart disease is the #1 killer among men and women. But what you may or may not know is that cardiac arrest is different from a heart attack. Not that you want either. So yes, a heart attack can cause cardiac arrest, but you can have a heart attack without having cardiac arrest, and you can have cardiac arrest without having a heart attack. Does that seem confusing? Don't worry, because I'm about to break it down. I'm going to explain the difference between cardiac arrest and a heart attack and give you 5 reasons why a cardiac arrest is more deadly than a heart attack. We will cover 1, the difference between a heart attack and sudden cardiac arrest, 2, the signs and symptoms of cardiac arrest, 3, the causes of a cardiac arrest, 4, I'll give the reasons why a cardiac arrest is actually deadlier than a heart attack, and 5, I'll answer the question, is a cardiac arrest a death sentence? And we'll discuss action steps. So let's get started. Cardiac arrest versus a heart attack. Now, a heart attack occurs when there is a blockage of blood flow to the heart muscle, whereas with a cardiac arrest, there is an electrical issue, a malfunction in the electricity of the heart. Let's start with heart attacks. With a heart attack, you have a narrowing or a blockage in heart arteries or coronary arteries, typically by a plaque or atherosclerosis. And when this occurs, it prevents oxygen-rich blood from getting to the heart muscle, and that heart muscle dies. With a heart attack, there are typically warning signs. The warning signs could be within seconds, minutes, hours, months, and you can get symptoms of a heart attack, such as chest pain or tingling in the left arm or both arms, jaw pain. Be sure to watch my video on heart attack symptoms, 7 warning signs you should never ignore, after you finish watching this video. The point is that with a heart attack, things are not sudden, they're not unexpected. With a heart attack, you may start to get some of these symptoms like the chest discomfort, and you may have time to call for help or tell someone, oh my gosh, I'm sweating, or my chest is hurting, or you may even be able to call 911 yourself if you have a heart attack, okay? So there are warning signs, it's a blockage of heart arteries, and that's what you're dealing with a heart attack. Now with a cardiac arrest, it's sudden. You don't get the warning signs. And a cardiac arrest occurs when there is a sudden and unexpected electrical malfunction of the heart that causes the heart to either stop beating completely or to move in an abnormal, unproductive rhythm. So the heart, even if it doesn't stop completely, if it is moving, it's moving like a bag of worms or in a fibrillation, like a ventricular fibrillation, and the heart is not pumping that oxygen-rich blood effectively to the rest of the body. So with a heart attack, there's blockage of blood flow to the heart. With a cardiac arrest, there is a sudden unexpected malfunction in the electricity of the heart. Now let's talk about the signs and symptoms of cardiac arrest. And remember, signs are what you see, symptoms are what you feel. Symptoms. So what are the symptoms of a cardiac arrest? Nothing. There's no warning. You could be walking around, talking, feeling fine, and then boom, you drop and you have a cardiac arrest. So no symptoms. Now, there are many causes of cardiac arrest, which we'll get into, and sometimes those underlying causes can have certain symptoms. But as far as a cardiac arrest itself, no symptoms. As far as the signs of a cardiac arrest, what you see. Now, they're not going to be warning signs of a cardiac arrest, like warning you that it's about to happen since it's sudden, but there can be signs that a cardiac arrest has occurred and it's time for you to leap into action. What is a sign? Well, if a person drops to the ground and they're lying there looking lifeless, they're not responding to loud noises, they're not responding to shaking or rubbing of the chest or anything that would typically cause pain or for them to withdraw, they're not withdrawing. That could be a sign that someone's had cardiac arrest. Also, if they're not breathing, if they have no pulse, or if they have a very weak pulse, and if they're not moving. All of these can be signs that someone has had a cardiac arrest and it's time for you to leap into life-saving action. What are the causes of cardiac arrest? Now, there are many, many causes of cardiac arrest. 1, a heart attack. And I know we're talking about heart attack versus cardiac arrest. There's totally different things, but a heart attack can actually cause cardiac arrest. If you have a heart attack and you blocked off the blood flow to a section of the heart muscle, and that heart muscle is now dead, and then develops into somewhat of a scar tissue, well, that can interfere with the heart's proper electrical functioning, and it could predispose you to a cardiac arrest. Also, if you have coronary artery disease, if you have congestive heart failure, that can lead to cardiac arrest, especially if you have a low ejection fraction, meaning that your heart is not pumping out blood efficiently. That could lead to cardiac arrest. If you have cardiomyopathy, where the heart is stretched, and that can affect the electricity of the heart and lead to a cardiomyopathy. You can have cardiomyopathy from things like viral infection, like a Coxsackie virus, or even if you've had a chemotherapy that has led you to having a cardiomyopathy. Sometimes certain habits like excessive use of alcohol can lead to a dilated cardiomyopathy. All of these things can put you at risk for cardiac arrest. Blood clots clots can lead to a cardiac arrest. For example, if you have a DVT, a deep venous thrombosis in the leg, and it travels up and eventually blocks the proper heart flow, that could lead to a cardiac arrest. Other causes include congenital heart disease, long QT syndrome, hypertrophic cardiomyopathy, Brugada syndrome. If you have a very high potassium, that can lead to cardiac arrest. Respiratory failure can do it. Drug overdose can do it. Heart valve disease can also lead to cardiac arrest. Another cause is commotio cordis. This is something that typically occurs in adolescents playing sports like baseball or doing martial arts or lacrosse, and it occurs when there is a blow to the chest at the exact right spot and at the exact right time in the electrical cycle of the heart to cause it to go into an abnormal heart rhythm. Let's talk about 5 reasons why a cardiac arrest is more deadly than a heart attack. You don't want either one, but here are the reasons why cardiac arrest is more deadly than a heart attack. 1, there's no warning signs for a cardiac arrest. At least if you're having a heart attack, you may have those warning symptoms of chest pain, sweating, shortness of breath. And with a heart attack, you may still be able to call 911 or call out for help or walk a little bit to get to some place where maybe someone can see you. With a cardiac arrest, it's sudden, no warning signs. 2, if there is no treatment for a cardiac arrest within minutes, you die. According to the American Heart Association, for every 1 minute that you go without getting shocked or getting that heart rhythm back with a cardiac arrest, the survival goes down by 10%. 3, with a cardiac arrest, there's often permanent damage. There's often permanent brain damage, permanent lung damage. There can be permanent heart damage. 4, in a cardiac arrest, you stop breathing. What's more deadly than that? 5, between 70 and 90% of the people who have a cardiac arrest outside of a hospital setting die before they ever make it to the hospital. And now to answer the question, is a cardiac arrest a death sentence? I know I've given some pretty grim statistics, right? I've kind of been a bit of a fun snatcher, a mood killer as I've described cardiac arrest, but it's actually not necessarily a death sentence. What is key is acting and acting fast. If you witness someone having a cardiac arrest, you must immediately activate EMS. You want to call 911 and you need to leap into action and start CPR. Even if you're not trained in CPR, go to heart.org and at least learn how to do some of the compressions where you're pushing down on the chest in about 100 to 120 times per minute to the beat of staying alive. And you want to do those chest compressions. And if you have been trained in CPR, which I strongly recommend that everyone become CPR certified, then you can actually administer proper and complete CPR. And you do the breaths as well. But even if you don't know how to do the breaths, you can just do chest compressions and that can help to save a life. Meanwhile, you want to get a defibrillator, an AED, an automated electronic defibrillator. The AEDs are located most places nowadays. You can even order one to have yourself, and they give step-by-step instructions. They're meant for people who are not healthcare providers. So please do not be intimidated by an AED. You hook it up, put the pads on the chest as directed, and the AED will tell you if a person needs a shock. Having that shock, having that defibrillator can save the life in a person who has cardiac arrest. So even though the statistics are a bit grim when it comes to cardiac arrest, no, a cardiac arrest is not necessarily a death sentence.